Hello and welcome to my channel. In this channel, we explain various nursing concepts in a simple form for a better and easy understanding. These videos could be used by both LPN and RN students as well as nurses who are trying to refresh their basic concepts. My name is Nasmosh. So let's wrap up our fluid and electrolyte series with bonds. I just thought that bonds will fit very well with this, and so let's get it going. So bonds, there could be various different types of bonds, and this could be either a thermal, chemical, electrical, or radioactive bond, and this would result in cellular destruction of the skin layers and underlying tissues. So bond can result in the loss of temperature regulation, sweating and sebaceous gland, the sweat glands and sebaceous glands are these small glands in the skin that secrete natural body oils into the hair follicles and that lubricate the skin and the hair as well. And it could also cause some function and sensory organ issues. So how do we assess burns? We assess the burns and severity based on 1. The percentage of the total body surface area, right, that got burned, right? The depth of the burn, the body location of the burn, because if somebody gets burnt in the face and in the legs, of course the person who has a facial burn will be more concerned with them because of the respiratory and airway. The client's age, a child has a small surface area compared to an adult. Causative agent, if it's chemical, if it's thermal, okay, and the presence of other injuries, and overall the client health and respiratory system involvement. When respiratory is compromised, we got a big issue. So some cardiac output maintenance. So fluid volume deficit, which is hypovolemia, will always be noted with patients with burns. And with this, IV fluids replacement using the Parkland formula is normally used because they will always have the fluid volume imbalance. Like hypovolemia is a go with burn patients. So how do we do this Parkland formula? So first, we administer 4 milliliters per kilo per percentage of burn. So will be for every kilo. So you'll multiply 4 milliliters and the kg of the patient and the burn percentage. And we'll talk about burn percentage moving on. We'll also administer half of the total fluids in the first 8 hours. So, for example, the patient needs maybe 2,000 mLs. We'll administer 1,000 mLs in the 8 first hours. And then we administer the remaining half in 16 hours. So we'll administer the first 1,000 if a patient requires 2,000. We'll administer the first 1,000 ml in a period of 8 hours. And then the remaining 1,000 will spread it towards the 16 hours. Okay? And we will deduct any fluid administered, stroke in or infused prior to patient's arrival from the first 8-hour total. So for example, they're transporting the patients and the EMS tell you, okay, we've already given the patient 500 ml bolus and the patient needed like 1,000 ml bolus for the first 8 hours. We're not going to go ahead and give them the 1,000 ml bolus in the 8 hours. No, we're going to send this patient to fluid overload, right? So we're going to remove the 500. We will give them the remaining 500 in the first 8 hours. And remember, the other 1,000, if the patient needed 2,000, it will be spread in the 16 hours that follows. So let's talk about the rule of the nines. What is the rule of the nines? The rule of the nines is actually how the percentage of the body, if it's a child or an adult, when somebody has a burn. So with a child, if the front and the back of the head is normally 18%, so these are the percentage that you use in the Parkland formula. So for example, the child has their front and back of the head burnt and it's 18%. So you'll plug it in there. You'll multiply 4 ml. And if the child is 2.2 kilograms, so 4 ml times 2.2 kilograms times the 18%, that will be your total amount of fluid that child needs to be replaced with. So the head is 18%. The back is 18%. The chest is 18%. The arm, the left arm and right arm, they are both 9%. The perineum area is 1%. The right and left leg, they are 13.5%. Let's go to an adult. An adult, the head, front and back is 9%. You see the difference? The child's head is normally bigger than the body most of the time. the back and the chest of the adult is 18%. Right and left arm, 9%. The perineum is 1%. The left and right leg is 18%. Okay? Each one of them. So let's talk about burn classifications. So there are 5 different burn classifications, and let's get into it. So the first degree, superficial, is our first burn classification, and it's the top layer, which is the epidermis, which is damaged, and it will appear as no eschar, mild edema, no blister. It will be tender and pink to red, and the causes of this could be sunburn or flash burns like steam or something like that, and there will be presence of pain with this kind of burn. The second burn, which is a second degree burn, which is a superficial partial thickness, and the layers involved with this will be the epidermis as well as the partial dermis, okay? And the appearance for this, there will be no eschar, there will be mild to moderate edema, it will be red to white with blisters. And some causes of this will be burn scars like hot liquids and steams and flames. And with this, there will be presence of pain as well. Our third degree burn, which is our deep partial thickness burn, and this involves the epidermis layers into the dermis, okay? And the appearance of this will be dry to soft, eschar will be formed, moderate edema, red to white with no blisters. And some causes of this will be exposure to hot objects for a prolonged time, grease, or even chemical burns and flames and burn scars. And then the patient will also experience pain. Our third degree, there's another third degree for this, will be full thickness. Well, full thickness will have epidermis layer involvement into the dermis and may extend into the subcutaneous and may have nerve damage as well. Because there are 2 different types of third degree. There will be either deep partial thickness and full thickness. This we're talking about the full thickness. And the appearance of this, it will have a hard inelastic eschar. The patient will have some severe edema. They'll have some red tan, black or brown, white with blisters. Okay, some causes of this is exposure to hot objects, excessive exposure, grease, tar, the one they used to make the roads, the black substance, chemical or electrical burns, burn scars, and may be or not painful. It may be painful or it may not be painful, okay, because this patient, they're fried, okay, the pain sensation maybe is not there. Our last classification for this will be our 4th degree, which is our deep full thickness. And with this, all layers plus the muscle is involved, as well as your tendons and bones. This is like you're fried to the bone. And the appearance of this will be black with no edema, right? All the fluid is gone. And causes of this are mostly chemical, and pain, there's no pain. All right. So let's talk about some diagnostic procedures, okay? So some diagnostic procedures that we'll do for these patients will be our CBC, ABGs, liver studies, urinalyses, BUN, serum creatinine, serum electrolyte levels, as well as chest x-ray. For deep burns, creatinine and myoglobin, because myoglobin will tell us muscle damage. And also we'll do a fluid shift check. So in the next video, we're going to talk about the how we'll do the fluid replacement, okay, and some nursing care for these patients. Thank you for watching. Please like, share, and subscribe to my channel. See you on the next one. Bye.